According to the last update on Health Ministry website, there are in fact 605 fresh cases of COVID-19 in last 24 hours. Now the caseload, the active caseload of India stands at about 4,800. Now remember, by the end of December, this was around 4,600, but there was in fact a sudden increase when we talk about the end of December 2023. There was in fact a major increase in the cases, but right now in this 1 week, from January 1st to January 7th, we are seeing that the cases are in fact decreasing. In fact, experts have been suggesting that there is a drop from 22% to in fact 5%. So that is of course a positive side that is being reflected by the experts at the moment. But unfortunately, there had in fact been 4 deaths that has been reported. 2 deaths that has been confirmed in Kerala and 1 in Karnataka and 1 in Tripura due to COVID-19. But the Health Ministry has in fact been saying that these are the backlogs. Now, if you remember, last week as well, there were about 28 cases that was reported, deaths that was reported due to COVID-19, and now there were in fact backlogs that has been reported by states. So there are 4 deaths that has been freshly reported, and now the tally has reached 31. Now Health Ministry also have in fact been saying that these deaths are not due to Jn1, the subvariant of Omicron. These deaths are all due to the comorbidities that the individual had, and then they got positive of COVID-19. Apart from that, when we talk about Kerala, remember till last week of December, the cases in Kerala were rapidly increasing. They in fact touched about 2,000, but right now the cases have in fact decreased. They have reduced to around 1,000. So there is a sharp dip in the cases in Kerala. But meanwhile, there is in fact a huge increase in the cases in Maharashtra and Karnataka. We have seen that the Karnataka government has made it very compulsory that a patient or an individual, when they go to a hospital with severe acute respiratory illness or influenza-like illness, they have in fact been asked to take a COVID-19 test, and in case they are positive, their samples will be sent to genome sequencing. Apart from that, the Karnataka government has ensured that people above the age of 60 with comorbidities need to take a vaccine, some sort of a precautionary dose that they need to take. Apart from that, we have seen that in Maharashtra as well, there is in fact a number of guidelines that has been put in place as far as the testing is concerned, as far as the vaccination is concerned. In Delhi, there are in fact 24 cases of Jn1 that has been reported. Now, the experts have been saying, when it comes to Jn1, it was first detected in November. Since then, there is in fact a rapid increase in the infection. We are seeing that the cases are increasing, but it is not really ending up to hospitalization. It is a mild variant, and people are getting treated at home itself. They are not really going to the hospital. So that is of course a positive side, and probably that's why the WHO has also classified Jn1 as variant of interest and not variant of concern. If you remember, the last variant that was classified as variant of concern was Delta variant, and we have seen the kind of havoc that Delta variant had done in India. So as far as Jn1 is concerned, yes, it is highly transmissible. It is speeding up the infection rate, but when it comes to the severity of the variant, it is very mild in nature, is what the experts have been suggesting. Meanwhile, the Health Ministry are constantly in touch with all the states. They have in fact asked them to keep a close vigil, ensure that any sort of positive samples, because each state has been given an amount of samples that they are supposed to send for genome sequencing, and further they could determine if there is any new variant or what is really the impact of Jn1. So far at the moment, we are seeing that there has in fact been 605 fresh cases of COVID-19, and the active case load stands at 4,800, which is seeing a dip from 22% to 5% in this first week of this year 2024.